doing complaint investigation, some preventative measures for abuse and neglect. Kelsey Cookingham, our complaint intake triage policy analyst, will be taking that away for us and presenting. Our support staff, Chris Stats, will be doing some information sharing about renewals for licensing materials. Jeremiah Adams is going to be discussing notice of transfer. And then our NFLU, NFSU, well, we're all the same team, but have any questions and answers if anybody has any at the end, if we have time. I will just go ahead and announce, as Kathy mentioned earlier, we will be recording this. So if anybody has any concerns with being recorded, this is your opportunity to go ahead and jump off the call, and you can always review the recording. I believe it's posted, right, Kathy, on our licensing website?
That's correct.
Okay, thank you. So with that, I just want to briefly let you know NFSU continues to be recruiting and hiring. So again, if you see multiple folks out in your facility and we're training up folks, like Provider World, we continue to, need staff and train staff. And so apologize for any inconvenience, but we will continue to, have new staff be joining recertifications and surveys. So, and just a friendly housekeeping reminder, if you are not on mute, to please go ahead and mute yourself. And with that, I will hand it over to Kelsey.
Hello, good morning, everyone. Happy Halloween for those who celebrate and happy Thursday for those who don't. I'm Kelsey. I'm the complaint intake triage policy analyst. And today I'm just going to be going over some housekeeping reminders for facility reported incidents, talking about conducting thorough investigations at the end of my presentation, and then going over for preventative measures for abuse and neglect. We're really diving into making sure that your quality assurance and performance improvement, QAPI, really is tracking those allegations of abuse and neglect and looking at patterns. Just a reminder that to only submit your facility investigations as well as your FRI forms using the FRI email on the form. It's fri.incidents@odhsoregon.gov. We've been getting a lot sent to our public email address as well as APS, and they have to forward it to us, so that causes a delay. So please just use that email. Also, please use the updated FRI form. The date on the bottom is for 2023, so that's the most current form, and it's available on the licensing website. All right, and I don't know, Christy, do you want me to just share my PowerPoint? I think I sent Kathy the slides. Just want to make sure if that's possible. I can do it that way, make it easier.
Yeah, we can do that. Dave's okay. Running the slide.
I don't know if they're on here. I just wanted to make sure.
You can steal this screen.
Okay. Let's see. Actually, it will be. Everybody can see that okay?
Yes.
Okay. All right. So we'll just continue. So I just wanted to go over neglect specifically when you're doing your facility reported incidents. Neglect specifically talks about the failure to provide goods and services necessary to avoid physical harm, pain, mental anguish, and emotional distress for residents. So that's what you're looking at when you're reporting allegations of neglect. It can be, a pattern of failures or one or more failures involving one resident and one staff person. And it can be, that staff are aware or should be aware of a resident's care needs, but are unable to meet those needs due to multiple reasons. So one example could be that there's a lack of training, lack of sufficient staffing, lack of supplies to meet resident needs, or staff lack the knowledge of the needs of the resident.
Excuse me,
and, I realize I have the wrong screen. I have 3 going on here. So let's get this sorted. That's better. Technical difficulties. Okay. Let me, always fun when it's on Zoom. There we go. Okay, so specifically I wanted to talk about falls. We've been receiving a lot of FRI forms that include allegations of falls. And a lot of them are because the residents sustain a significant injury, but they still don't need to be reported to us. So for a reminder, all falls do need to be reviewed. They still need to be looked into to determine that root cause. So you're going to be looking at, does that fall, is the reason that that fall occurred due to abuse or neglect? So for example, we received one recently, an alert and oriented resident. They tried to put their socks on, didn't call for help from staff, thought they could do it themselves. They lost their balance, fell, and sustained a hip fracture. So that would not need to be reported to us because that's not an alleged violation of abuse or neglect. Again, all falls do need to be reviewed, but when you're determining whether to report that to us, make sure you ask yourself, what is that facility failure? And was that fall, was that root cause due to potential abuse or neglect? And, and similarly, we've been getting some for, resident deaths. And while, it is concerning if a resident dies unexpectedly, we want to know too, what is that alleged abuse or neglect that may have caused that death? Was it a change of condition that wasn't addressed timely? Those would be what we'd want to look at, but just a death in itself doesn't necessarily need to be reported. So some considerations for our Regulation 609, that's our reporting requirement. Making sure that you provide sufficient information to describe what that alleged violation is that you're reporting and how residents are being protected. It talks about in 609 that the facility must provide as much information as possible to the best of their knowledge at the time of submission. We get a lot of reports that are very vague in nature. They'll say something like, resident reports they were touched inappropriately, or resident reports they were raped last night. And that's not giving us a clear picture, of what's going on. That really raises those red flags and makes us think, oh, we really need to get out there right away. So an example of a facility providing, more information, this happened years ago, but a resident reported they were sexually assaulted on a pool table by 13 male staff members on night shift. And the facility right away went and interviewed that resident, and they said, I did watch a movie last night. It could have been a dream. And the facility let us know too, that they didn't have a pool table and they didn't have 13 staff working night shift, 13 males. So that information is really helpful because it gives us, time to go, okay, I think we can wait for the investigation instead of having to send someone out right away. And this is just an example. This isn't to call anyone out, but this is what we receive a lot of times is really limited information, report of resident to resident incident. It doesn't talk about whether it's, sexual abuse, physical abuse, what actually happened, doesn't talk about how residents are being protected. It just says they were separated. So really, again, providing us as much detail. If it's an allegation of abuse or results in a serious injury, you have up to 2 hours to report. So while you're still going to report all concerns, it's really important to, go to that resident and ask specific details when they're saying, what does inappropriate touching mean? Can you tell me more information? And really providing us with as much detail as you can at the time of report. Another reminder for injuries of unknown source, making sure you're not reporting to us injuries of unknown source unless all the following criteria are met. So first, that source of the injury wasn't observed by anyone. So let's say you find a resident with a leg length discrepancy indicating a fracture. Nobody knows how this resident got that fracture. The source of the injury couldn't be explained by the resident. They might have a cognitive impairment or aphasia, might not be able to say what happened. And lastly, that injury is suspicious in nature because of the extent, or the location, if it's breasts or genitals in between thigh, on the thighs, inner arms, neck, suspicious areas, the number of injuries at one particular point. So maybe a resident's covered in bruises head to toe, or the incidence of injuries over time. You're seeing that same injury, and it's going to kind of raise again that red flag. So risks for abuse in facilities. Our state operations manual talks about that there are some facility characteristics that can increase the risk of abuse for residents. And these things include unsympathetic or negative attitudes towards residents. And that could be staff maybe coming, working for a paycheck, or maybe there's reasons why they have those attitudes, such as chronic staffing problems, lack of administrative oversight, staff burnout, stressful working conditions, poor or inadequate preparation for taking care of residents, especially residents who have cognitive limitations or behaviors, really training your staff, because that puts residents at risk for staff to be overwhelmed and not able to mitigate those behaviors. Deficiencies of physical environment. So maybe tight quarters for residents, there's not a lot of room to move around. A resident with PTSD, it's a loud environment that causes behaviors to occur, those kind of things. And lastly, ensuring that your policies operate in the interest of the resident versus the institution. So making sure those policies are resident-centered. And we receive most of our reports of alleged abuse are resident-to-resident altercations. So F600, which is our abuse and neglect regulation, talks about that resident behaviors might provoke a reaction from other residents as well as from staff. So for some examples, of a resident who is screaming, cursing, insulting someone based on their race or ethnicity, that can cause an altercation. And oftentimes we see that a resident will intervene on behalf of another resident or on behalf of a staff member, and that can cause an altercation. Looking at your residents with behaviors, if they're hitting, kicking, throwing things, that could cause things to escalate. Or if they're saying sexually inappropriate things, touching, grabbing other people. It talks about that resident abuse can include a resident who has no prior history of aggressive behaviors, but it could escalate quickly. So the example is, a resident wandering into another resident's room, taking their things, touching things, rummaging through their property. That can cause another resident to escalate and maybe, push them away, yell at them, those kind of things. So F607 is specifically our policy and procedures for abuse and neglect. So facilities must develop as well as implement their policies and procedures that prohibit and prevent abuse, neglect, exploitation, and misappropriation, and also establish coordination with the QAPI program. So Section 8 specifically talks about that those policies are going to define how staff are to communicate and coordinate situations of abuse and neglect with that program. And then specifically, it talks about in cases of physical or sexual abuse, either facility staff or resident to resident, it requires corrective action and tracking by QAA, which is the Quality Assessment and Insurance Committee. So the coordinated effort is to really determine with these allegations if a thorough investigation is conducted, if residents are protected, whether an analysis was conducted as to why that situation occurred, so that root cause. Any risk factors that contributed, so we're talking about residents with behaviors or those environmental factors, what's causing that, as well as if there's further need for systemic action. So that could be changing your policies and procedures, educating your staff on abuse and neglect, how to identify a report, talking to your residents and families about, how to report without retaliation, making sure that they feel they can report. And also ensuring that you're tracking these trends. So if you're noticing, you're seeing a lot of resident to resident altercations with the same alleged perpetrator, you want to make sure you're addressing those concerns, you're tracking that information. on to our requirements for thorough investigations. I talk about this often. I was just talking at OCA about this, but we're seeing still the same patterns of investigations not encompassing all the required pieces. So while CMS doesn't have a specific, formula of what an investigation needs to have, it does say that the facility must thoroughly collect evidence to determine what actions, if necessary, are needed to protect residents. So really what we would see in an investigation would be things like observations, looking at your alleged victim, if there's any injuries, the location, and staff and resident interactions or resident to resident interactions. Interviews, making sure you're interviewing everyone involved, including other residents. Record review, looking at if it's a medication error, you're going to look at the MAR. If it's a financial concern, you're going to look at financial records. And reminder too, that even if this has been reported to law enforcement as a suspected crime, you're still going to do an investigation in conjunction with law enforcement. The facility is still required to do their own. So some best practices, these are the 3 things that are most commonly missing when we receive those abuse investigations. So first is just making sure that you're including summaries that are thorough, include information on how you made that determination if abuse or neglect was ruled out or verified. So really telling us what you looked at and how you made that determination. Second, that you're submitting all interviews. So not just saying we interviewed staff, but saying, here's who we interviewed, this is what they said. Other residents, especially if it's staff to resident abuse, is so important. CMS is actually citing facilities at F610 for not having thorough investigations solely based on not interviewing other residents. And on the next slide, I'm going to talk about why it's so important to have those other resident interviews. Lastly, making sure that you're highlighting what changes are being implemented to prevent repeat incidents. So again, if it's a resident with behaviors, what are those care plan interventions you're putting in place to mitigate that? And then it also includes corrective action if the allegation is verified. And I'll talk about that a little bit more as well. So not only do I talk about taking allegations seriously and making sure that we're investigating all allegations of abuse and neglect, but this is the reason why it's so important too that we are doing thorough investigations. This is a real-time example of a facility reported incident. This was an allegation from a resident, and the facility did a good job and interviewed other residents and were able to determine that it was a systemic issue with this particular CNA. The allegation ended up being true, and the DA is actually involved in their criminal charges being pressed. So that's why I talk about, making sure you're doing a very thorough investigation, you're interviewing staff, and you're interviewing other residents so you can see the whole picture.
Okay, send it to me.
I think someone's on not muted. Lastly, F610. So this is the key elements of noncompliance. So it talks about in this regulation that in order for a surveyor to cite deficient practice, they have to show that the facility failed to do any one of the following. So that would be that the facility failed to initiate an investigation into alleged abuse, neglect, or exploitation. They failed to complete the thorough investigation, and they failed to maintain documentation that it was thoroughly investigated. So we talk about on survey, if it's not documented, it's not done. Also, making sure that the facility prevented further potential abuse and neglect while the investigation is in process. So that's why we always have on that initial fry what's being done to protect residents. Lastly, taking corrective action following an investigation if the alleged violation was verified. So it's similar to a 2567, you're going to put in there your plan of correction on how you're going to mitigate and prevent future issues from occurring. You're going to put in that full plan of correction and you're going to take it to QAPI. And that is all I have for you. If you have any questions, please feel free to email me and I believe Chris is next, and I will let her go and stop sharing my screen. Thank you all.
Thank you, Kelsey.
Thanks, Kelsey.
Hey, Chris.
Hi, good morning. This is Chris Stats, and I interact with you when there's notification of personnel changes or there's submission of the annual renewal application documents. With regard to submitting the licensing renewal documents, just like to go over the fact that we would like them in the PDF form as well as individual forms. And anyhow, the 0466 in particular is important. It's important that we receive one from the operator or the management service. And if there is a different licensee or owner, we receive one from that area as well. Paying special attention to line 6. And that's the registered agent information or the authorized representative. What we would like to see there, and we do verify this with the Secretary of State's office, is the current name, and they must be registered. And if we notify you that it seems to be not in conjunction with what we're needing, the name's different than what's online, then we'll ask that that be updated or provide an explanation. Also on that 0466, on line 18, it goes over the types of services offered, and that's whether it's for Alzheimer's or ECU. Please include the number of beds that you have. That's important as well. That determines how much we are charging for the mental health part of it, if you have that. So lines 26 through 31. That's the insurance policy information. And if you have current expiration dates, but they will be expiring before the next renewal, we ask that when it's updated that you provide us with a new 0466, regardless of your renewal month, just so that we have the current information. Now on the 0466C, that's a credit check. And we do ask that there is a form provided for each person with ownership of 10% or more. And on the 0466D, that's the provider ownership and control interest statement. Please provide the doing business as and the assumed business name of the nursing facility. And that name must be registered with Oregon Secretary of State's Corporation Division. And sometimes people put what the legal name is or what they call it internally, and what we need is the doing business as name. So sorry, I'm getting over a cold, so I'm having a hard time talking. But anyhow, if anybody has any questions on that, feel free to either reach out to me personally on email and I'll go over things with you. But otherwise, these are just the annual reports that we ask that they be individual, that they're emailed to us. And if you have any questions, you can reach the nif.licensing@odhs.oregon.gov, CCing Kathy Orris and myself, Chris Stats. So if there's no questions, I'll go to the next item, and that would be providing updated contact information. So by email, we ask that notification of staff, key staff changes be emailed to us at the NIF licensing, Kathy Orius and myself. Please include the name of the staff member that's exiting, the date they are exiting. For the new person, provide their name, their email with a corporate domain. We cannot take personal email addresses because of our information system requirements regarding it being secure. and provide us with their cell phone number or their internal number with an extension, as well as their license number. We do ask that it's an immediate notification of these key staff changes, and we receive them from corporate. That's the person that we typically deal with when we're receiving the documents for renewal. And so it needs to be from the corporate office, not the admin themselves that's coming in or going out. We'd like to have an immediate notification if there's a change of administrator, director of nursing services, infection control specialists, or medical directors. If there is a change of key corporate staff changes, we'd like to know that immediately as well. And that usually comes from the person who submits the renewal application documents. What we'd like to know is there a change in your registered agent or your personal or authorized representative. And that also needs to be changed with the Oregon Secretary of State's Corporation Division. So if you have any questions regarding that, feel free to reach out to me directly, but you can also reach out to the NIF licensing email box, CCing Kathy and myself. If there's no further questions, feel free to email me, let me know.
Thank you, Chris. I appreciate the update and the reminders. With that, I'll hand it over to Jeremiah to chat about notice of transfers. And it looks like we have some training opportunities he's going to go over first with Senate Bill 99. So thank you, Jeremiah.
Thank you. Hi, everybody. My name is Jeremiah Adams. I'm a policy analyst with the Nursing Facility Licensing Team. First, going to talk about, and I think talked about this at the last news hour, the new LGBTQIA2S plus administrative rules that have went into place. They are final now. The training requirement that all staff complete the training by the end of December 31st. It's a mandatory training for all administrators, staff, not only in nursing facilities, but other long-term care settings, such as residential care, assisted living, and adult foster homes. And I am also going to go over how to fill out an involuntary notice of transfer today. Please place any questions in the chat or wait till the end if you have questions. So the first two parts of the notice are the easiest parts: the name of the facility and the name of the resident. Next part of the form is copies of this notice were sent to the following people. And you'll notice it says include the address and the relationship to the resident. There's going to always be at least 3 people listed in this area: the resident who needs to receive their notice personally, the long-term care ombudsman, and the local DHS APD office. Those are folks are all required to receive a copy of the notice. The long-term care ombudsman's office and the local DHS office where your case managers are based out of, they must receive a copy of the notice by registered or certified mail. That's extremely important. You can send them or fax them a copy, but you also have to send a copy certified or registered mail for it to be a valid notice. So moving on, date of proposed transfer. This is an important one also. The minimum that you can issue the notice of transfer for is 30 days. When you count your 30 days, day 1, you would count the day after you issue the notice. You don't count day 1 as the date the notice was issued. I always recommend issuing it for 31 days just to ensure that you've met that 30-day requirement and you're not at 29 days because you miscounted a day here or there. So that's my recommendation for coming up with your date of proposed transfer. If you want to do 45 days or 60 days, that's completely up to you as well. But it's a minimum of 30 days. The location that the resident is going to. This is probably one of the most important parts of the notice. You want to make sure that it's only one location and not more than one location on the form. Please do not put multiple locations or to be determined. You need to have a specific location that you're planning to transfer the resident to. Putting more than one location or putting to be determined makes the notice invalid, and you're going to have to issue another notice, a new notice. In addition, the resident still, if this resident still requires care and services, you're going to need to find an appropriate discharge location, another care facility to put on this notice. So if you have a resident who needs help with all their ABLs, you can't put down a motel or a shelter as the discharge location. So you're going to need to send their packet to other facilities, nursing facilities, or if they could be successful in a lower level of care, you could reach out to residential care facilities. Once you find another facility that agrees to accept the resident, you would use that location on your involuntary notice of transfer as the discharge location. Please know also, let's say you issue an involuntary notice of transfer and the resident challenges the notice, or the ombudsman assists the resident in challenging the notice, and it goes to an administrative hearing. The burden of proof is on the facility to prove the requirement, whatever you choose, whether it's emergency or welfare reasons, non-payment, that you prove your case regarding that administrative rule, and you're also going to need to prove that it's a safe discharge location where the resident is going to. So just please be aware of that. You know, what the administrative law judge a lot of times asks, and they would ask the resident, they're asked someone representing the resident, do they think that they could be successful living independently at this new location if you have them going to a motel or their family's house or something like that. So just be aware of what the administrative law judge will be asking at an administrative hearing. The next section, this action is taken or proposed to be taken because you can choose more than one of these boxes. If you do, you would be required, again, to show the burden of proof for each one of the selections that you make. Our suggestion is to choose one reason why you're issuing the notice of transfer and ensure that your paperwork and documentation is in order for that one reason. So you check, let's say the facility, there's due to a resident's extreme behaviors. So you check the medical emergency or welfare reasons box. But we're not done there. So down below, there's a little arrow on the screen, says more specifically. This action is taken, proposed, include the specific subsection of the OAR, which gives the facility the authority to issue this notice. So for the example that I just gave, if you're issuing it for behaviors, in this section down below where it's under more specifically, you would want to put OAR 411-088-0020 1 little c, and that's the specific OAR regarding behaviors why you would be issuing an involuntary notice of transfer. And this is important to ensure that the notice is valid so that you don't have to issue another notice. So you not only want to check the appropriate box, but then you also want to put the specific OAR down in that section below. You can also include additional information why you're issuing the notice. So let's say you check the non-payment box, you would put down the specific subsection of OAR down below, and then you could say, you know, the resident owes this amount of money currently, and you tried several different ways to get the resident to pay their, whether it's a liability portion or if there's another amount due. Those are the most important parts of the notice. Also there's not a picture on the screen, but down at the bottom of the notice, you need to sign and date the notice. Make sure that you signed and dated before you issue the notice to those required parties, which is the ombudsman's office, the local DHS office, and the resident who must be served personally. We would request, it's not in our current administrative rules, but we would request that you please send the NIF licensing box a copy of the notice when you send the notice to those other parties. While it's not a requirement, it allows us to be aware of what's going on with each facility, what notices are currently in place, because we track each notice that is issued, and when a resident wants to challenge the notice. So we really would appreciate that, and that would just go to the NIF licensing box. Also, I'll throw this out there. If you need help filling out one of these notices, if you're a new administrator, you've never done a notice like this before, or you just want it to be reviewed to ensure that it's accurate and valid, and that you hopefully won't have to issue a new notice again, you could send it to us for review to the NIF licensing box as well, and we can talk you through issuing the notice and talk through the situation with you, because it could be a situation where issuing the notice is not appropriate, or we can give you suggestions about the specific situation to help with the situation, because I know nobody likes issuing these notices, and they're difficult for the facility, the resident, everybody involved. So we're here to assist with that. And I think the next slide, a heads up. The long-term care ombudsman office address is different than is on that form. The form number is 0509. The address on the form is incorrect. This is the correct new address for the long-term care ombudsman office, where you would send that certified or registered mail to. You could, again, there's the LTCO's email address, so you could email a copy to them as well, but the requirement is that they receive a copy registered or certified mail. Is there any questions in the chat, Kathy or Dave?
I'm not Kathy or Dave, but we do have one, Jeremiah.
Okay.
So if a resident chooses to challenge the notice, what are our requirements to assist them in doing so? What steps are we required to take in an effort to support them in appealing the notice?
That's a good question. Please, as soon as a resident, being that you have to issue it in person, and it can be uncomfortable. I know sometimes residents get upset. They might kick you out of their room. They don't want you there. But when they calm down, they might say, I don't want to leave here. What can I do to stay here? How can I challenge this notice? So please, you can have them reach out to us, or you yourself, if they're not able to, please, administrators, please reach out to us and say, we issued this notice of transfer. The resident has indicated that they want to challenge the notice. And then what we'll do from that point is set up the informal conference, which is the first step in the administrative process. And that's where we can talk through with the facility why the notice was issued, and really ask if there's anything the resident can do for the facility to withdraw that notice of transfer. Like, let's say they're not paying their liability portion. If we can have a frank conversation with the resident and maybe, potentially their family member about how it's necessary for the resident to pay their liability portion. And if they just do that, then they can continue to stay at the facility, even if there's a past due amount owing. Or if it's regarding, behaviors, or let's say, smoking, talk through that situation. If the resident understands that they can't continue to do what they're doing, and they said that they will change their behaviors regarding a certain thing that they're doing, why the notice was issued, and maybe that's another opportunity for the facility to give the resident another chance, another opportunity, and withdraw that notice of transfer. And if we're not able to come to a mutual agreement, we send all of the information over to the Office of Administrative Hearings. And then at that point, There's two parties to the case. One would be the facility and the other would be the resident. DHS would not be a party in the case. We listen in to the administrative hearing in case the administrative law judge has questions for us, or sometimes the resident or maybe an ombudsman or somebody representing the resident might call us as a witness. So we listen in and are available to answer questions at the administrative hearing. Just to let you know, the administrative process, unfortunately, is not an extremely quick process. So after the informal conference, we send we need a copy of hearing request, and we need a copy of the notice. We send that over to the Office of Administrative Hearings. From that point on, we're kind of hands off. The Office of Administrative Hearings will send notice out to the facility, out to the resident, out to DHS when they plan to hold the administrative hearing. It could be as early as a week. It could be 30 days or more later after we send the information over to them. It depends on how many administrative law judges they have available in their schedules. And then after the administrative hearing occurs, the administrative law judge usually has 2 weeks to issue that final order to the resident and to the facility. So all in, we're looking at 45 to 60 days for the administrative process to be complete. Now, please know that during that time, you cannot transfer the resident from the facility. Even if you go past that 30-day time period when the resident is scheduled to be discharged, you cannot transfer the resident until the completion of the administrative process. Now, if the resident changes their mind and they say, this other facility doesn't seem so bad, I'm okay with moving there, then the resident can choose to move to that other location, as long as obviously they have a bed available at the new location, and they would be able to move it at any time. Any other questions about? Oh, I see a hand up.
Yeah, it's Eugenia.
Yeah, it is. Hey, Jeremiah, I have a quick question. So, in certain circumstances, let's say you're moving a resident out because of safety concerns or whatnot, is there an opportunity to ask the administrative law judge to expedite that hearing? I know sometimes they can, not necessarily always, but is that something providers could do, is, ask the judge, hey, we've got some very unique situations and we'd like to try and expedite the process for the safety of the resident and also for the safety of the provider?
Yeah, on the hearing request form, there is actually a box requesting an expedited hearing. So that's a good question, and that leads me to as well. Let's say we have the informal conference and we're not able to come to a mutual agreement, so it needs to go on to administrative hearing. A lot of times we ask someone, and it could be the long-term care ombudsman, it could be the resident's case manager, but sometimes neither of those folks may be involved. They might not be qualified for Medicaid, so they don't have a case manager, and maybe the ombudsman, they don't want the ombudsman's help, so they're working, just doing this alone. We would ask that the administrator fill out the hearing request form, and on that hearing request form is a question for an expedited hearing. I think either party, I believe, could probably request an expedited hearing, and the Office of Administrative Hearings would make a determination whether to grant the expedited hearing or not. But there's a little box on the hearing request form to check if a expedited hearing is being requested.
And Jay, I'll add, I see Kathy's hand up. Sorry, Kathy, but I'll add real quick that if it's a right of return and the facility is denying the right of return, either return or readmission to the facility, there are times when we may ask for an expedited hearing as well on behalf of the resident. So that can happen sometimes as well. Sorry, Kathy.
I just wanted to chime in that also that expedited hearing request is not guaranteed. The judge looks at the scenario, so you can request it, but it can't be guaranteed. I'm just letting you know, like, there are some cases that the rule absolutely requires expedited hearings. But if you're asking it just, because you both want the expedited hearing, it may not meet the requirement for the judge and their backlog. I'm just letting you know.
Thanks, Kathy. And like you said, the reasoning, if it's due to a non-payment issue, I don't think that they would expedite the hearing based on a named non-payment issue. But if it's extreme behaviors, I think they would be much more likely to look at a scenario like that to be able to grant an expedited hearing.
Exactly. They'll weigh the pros and cons and the safety issues around it. So that's right, Jay. Thanks.
Yep. Any additional questions? Again, you can always reach out to the NIF licensing box if you feel like you want to talk through a difficult situation, or if you want to issue a notice. Please feel free anytime to reach out to us through the email address or by telephone.
I think since we have a couple extra minutes, a couple other things I'll mention really quick. We talked about this at the last news hour, but if every time a resident goes to an acute care setting, you also need to issue a notice of transfer, and we developed a separate form for that. That's a more simplified form. If you guys need that, let us know. But just wanted to remind everybody that every time someone goes to the hospital, the facility needs to issue a notice of transfer for that as well. And then also, every time you issue the notice of transfer, make sure you're also giving the resident a copy of the Leaving the Nursing Facility brochure. On the back page, if it's all folded, on the back page, there's a place where the resident can handwrite in or phone number for us to call to request the hearing. So it's really important that they have that so they know how to request it. But as Jay said, if there's any indication that a resident doesn't want to leave or might want to request a hearing, it's in your guys' best interest to reach out to us right away, because the process can take some time. So if we can get that process going sooner than later, it will help a little bit in the end. Kathy.
Just one note, remember maybe not everybody attended our last news hour in July, but we have a slide dedicated to how to order those printed materials. Chris, you can always reach out to Chris, but you can also look up the information on our news hour link. It's our communications page where this will also be posted in the slides. So if you need reference on information, sometimes it's good to look at a previous news hour because we might have touched on it and you might have the information at your fingertips. Just an FYI.
Thanks, Kathy. And sorry, Chris. I just have one thing to piggyback on what Dave said, because actually I've seen a few in the last week or two come in. Please do not use Form 0509, the involuntary notice of transfer, to report when a resident goes out to the hospital. We've been receiving some of those from some facilities, and so please do not use the Form 0509 if you have a resident going out to the hospital. That's a separate form, the one that Dave spoke about. Please use that new form and not the 0509.
You. Any other additional questions with the last few minutes that we have?
Yeah, I just posted in the chat that this is Chris, and if you guys need any assistance in ordering the forms, please feel free to email me, and I put my email address in the chat. That's to order the Leaving the Nursing Facility brochures or additional copies of the Do You Have a Complaint poster.
Perfect. Thank you, Chris. And great question. The next news hour is scheduled for January 30th. So be probably the same time, 11 to 12 seems to work out best for everybody. So please join us January 30th. Also, we are trying to get it through for this time, but we're working on developing like a Survey Monkey for folks to fill out after we have news hours and other trainings to improve our end of things, how we present, what works well for you guys and what doesn't, what you would like to see, what helps, what additional trainings or information you would like provided or shared. You never have to wait. You can always, if it's complaint related, you can reach out to the complaint folks. If it's licensing, you can, well, the website's right or the email's right on there, but you can always reach out anytime. We're always open to feedback and, improving our processes as well. So, but look forward to rolling that out in the new year so we can see again how we can improve as well. So with that, I'll final call for any other questions or comments before we have 9 minutes back.
Kathy made a good point in the chat that we need to remind folks that all of the state email addresses that used to be at state.or.us have been changed. They're no longer active and they do not forward to the main boxes. So please note that it's at odhs.oregon.gov now. And if you have any questions as to what email address to use, please feel free to reach out to us as well.
Great reminder. Thank you. Yes, we do not get those forwards anymore. And so, right. Well, again, thank you everybody for joining today and really appreciate the ongoing collaboration and working together to make residents' lives the best we can. So with that, thank you.
Bye,
Thank
everybody.
you.
Bye.
Thank you. Bye.
Thank you.